Yep, my name is Tamra Ruymann. I am the Chief of Digital Health at Physicians of Southwest Washington, now called or doing business as PSW. So I think the care management solution is a big deal. If you go out on the market, and I'm not super familiar with what's available today, but back when we were really looking, if you went out to put out an RFP and look for a solution, there wasn't really a lot out there that worked well or came with a user interface that was easy. I like to call the in-care module the TurboTax environment for care management because it's very user-friendly. And it's been the most successful, I think, for our organization in just being able to stand up care management in a way that is satisfying to our nurse care managers and our care navigators, and then also allows us to report out on what we've accomplished through that product. One of my comments on that is when we went live, Aaron Bohr actually came to train our care management nurse team. We spent a half a day training, and for months I was getting commentary from the nurses about how wonderful the application was, and that's just not a normal experience when you're creating massive change, especially in certain user groups. So it was fantastic. We are working to go to market with our care management solutions. We've done it by word of mouth up until this point, and now we're really getting serious about taking that service out and being able to scale out our care management team through the use of AI so that they're not having to spend their time doing documentation through all of it, but really engaging the patient differently. And then we're not having to hire as many nurses to work, I'm making the number up, but one nurse to 10,000 patients in commercial lives or something to that extent. I think that tool is going to make a difference in productivity. And, we talked a little bit about bringing empathy back into the space. And I think that the AI or Sara for care management, the scribing tool, is also going to allow us to focus more on the patient and less on the documentation. So I do think that that's really exciting.